in this video we are going to talk about the hormones which are formed by placenta. So actually the placenta forms four types of hormones. So the first one is progesterone, the second one is estrogen, the third one is HCG, and the fourth one is HPL. So what are these hormones, what is that, everything we are going to understand now in this video. So first we'll start with the progesterone. So actually progesterone is, in the early week of pregnancy, the progesterone is mainly produced by corpus luteum of pregnancy. Okay, so corpus luteum of pregnancy will produce the progesterone in the early week, and later on there is a shift called as luteal placental shift. So luteal placental shift, here what happens is there is a functional shift from the corpus luteum to the placenta. So there is a shift from corpus luteum to placenta. Means what it means that now the progesterone is produced by placenta but not from corpus luteum. So in the early week of pregnancy, the progesterone is produced by corpus luteum. But now there is a luteal placental shift where now the corpus luteum is not producing progesterone. There is shift towards the placenta. So this shift takes place from 7 to 9 weeks, or exactly you can say at 8th week. So first we'll understand what is the lifespan of corpus luteum. So the lifespan of corpus luteum is about 10 to 12 weeks. Okay, so these are some important points we need to know. Now let us understand how naturally the progesterone is producing from the placenta. So progesterone, actually its precursors are LDL, maternal LDL, and also cholesterol. So in the name itself you can see here the sterone word, right? So sterone refers to fat. So LDL and cholesterol, these are the precursors for the placenta to produce the progesterone. Okay, maternal, especially maternal LDL and cholesterol. So now the progesterone will be produced. So how much it will be produced? The progesterone, especially per one day, there is 250 milligrams per day. 250 milligrams per day. But in the case of twins, as there are twins, we need to send it to two of them. So it will be around 600 milligrams per day. So because of progesterone, there are two reactions which are going on. The first reaction is called Residual reaction. What is Residual reaction? In this reaction, the uterus will be hypersecretory. It will become hypersecretory, and the stroma of uterus will be edematous, and also it is rich in glycoprotein. Okay, so this is Residual reaction. There is another reaction going on in the uterus that is called as Arias-Stella reaction. So what is this reaction? Arias-Stella reaction, here also the uterus will get hypersecretory. Along with that, there is change in the nucleus. Okay, there is changes in the nucleus, and this Arias-Stella reaction can be seen in either intrauterine pregnancy or in molar pregnancy, also in ectopic pregnancy. So in all these cases you can see this Arias-Stella reaction. So this is all about progesterone. So progesterone precursor is maternal LDL and cholesterol. In the early week, the corpus luteum will produce it. In the later weeks, there is a luteal placental shift where the corpus luteum will shift towards the placenta. So placenta start producing progesterone at the time of 7 to 9 weeks, or you can say 8 weeks. And the lifespan of corpus luteum is 10 to 12 weeks. And progesterone per day, it is produced 250 milligrams. In the case of twins, 600 milligrams. And there are two reactions which are going, that is Residual reaction and Arias-Stella reaction. Now let us move on to estrogen. So mainly in this video we will complete the progesterone and estrogen. In the next video we will discuss about HCG and HPL. So estrogen. Actually, estrogen cannot be produced by placenta from the maternal side because there is lack of 17 alpha hydroxylase. There is lack of 17 alpha hydroxylase enzyme. If there is no 17 alpha hydroxylase enzyme, then the progesterone cannot produce from the maternal side. So now, estrogen cannot be produced from the maternal side. So actually, why this enzyme is required? Let us see. For example, 17-OH progesterone. Okay, in the presence of this 17 alpha hydroxylase will get converted into androstenedione, and actually this 17-OH progesterone is a C21 steroid and this androstenedione is C19 steroid. Actually, we need this androstenedione C19 steroid for projection of estrogen from the placenta. But here in the maternal side there is no 17 alpha hydroxylase, so the progesterone will remain as progesterone, so that there is no formation of C19. So now placenta will take an alternative. The placenta want to produce the estrogen. So to produce the estrogen, placenta will derive the estrogen from the fetal adrenal gland. Why? Because fetal adrenal gland, in the presence of ACTH, fetal ACTH, it will produce a DHEA sulfate, which is a C19 steroid. So you have seen that from the fetal side there is availability of C19 steroid, which is useful to produce estrogen. So now in the placenta there are two enzymes, that is sulfatase and aromatase. So sulfatase and aromatase, in the presence of this both enzymes, this DHEA sulfate, that is a C19 steroid, will directly form the estrogen. So like this we can form the estrogen from the fetal side. So remember, the placenta will produce the progesterone from the maternal side. Estrogen is produced in the placenta from the fetal adrenal gland. Okay, so this is very important. Now coming to the most common type of estrogen during pregnancy is estradiol. Okay, that is, you can see a word dio means E2. Okay, and most specific estrogen is estradiol. So see the names, trio means 3, right? E3. So E3 is most specific, but the most common is E2. This is important, estradiol. Now coming to some in which cases there is increase of estrogen and decrease of estrogen. Okay, so in what cases? So increase of estrogen can be seen in erythroblastosis fetalis, that is in the case of Rh incompatibility. Why? Because here there is more placenta. If there is more placenta in this case, you can understand now, the more placenta will try to drag more estrogen from the fetal adrenal gland, right? That is the C19 steroid. So there is increase in estrogen in this case. So there is another cases where there is decrease in estrogen. So decrease in estrogen, you can see this cases especially when this adrenal gland is not present in the fetus, or it is very hypoplastic in the fetus, and this case you can see in the case of anencephaly. So in anencephaly, what happens is, in the fetus there is no adrenal gland well developed, or there is hypoplastic adrenal gland, so there will be low estrogen in the placenta in this case. And also whenever there is absence of this placental enzymes, like as we said aromatase and sulfatase, then that C19 steroid cannot be converted to estrogen. So in this case also there will be decrease of estrogen. Okay, and other cases like Down syndrome. In Down syndrome, the problem is there is overall decrease of C19 steroid. So if there is decrease in C19 steroid in the fetus in the Down syndrome, then also there is a chance of decrease of estrogen, right? So these are all the reasons. And also the other reason may be fetal demise. If the fetal is already dead in the womb, then also as there is no fetus, there will be no adrenal gland, of course, so no estrogen. So these are the causes. So I hope you understand about estrogen and progesterone in a well way. So next we'll start with HCG, that is human chorionic gonadotroph, and HPL, okay, human placental lactogen. Okay.